When we monitor thousands of people every day, we start to see alarms, meaning when their heart rate is out of range or their blood pressure is out of range. How many of them are valuable? Probably 10%. And that's, in a nutshell, the problem. How to make sure that we're getting the alarms that are valuable and not the alarms that are not valuable. Each and every one of us is different. How do we start understanding patients at an individual level? That is what CalmWave is trying to solve. And now when we fast forward over a year, working with the CalmWave team, they've done that. And we're seeing some amazing results. And we're seeing a reduction in alarms that are not valuable. We're solving the issue of alarm fatigue for nursing and for physicians and for the patients in the room so that it's not beeping so much. Well, why is that important? Because essentially it leads to better patient outcomes, faster delivery of care. It's all around better care.